Well, a different public health crisis is claiming the lives of more young adults, as San Luis Obispo County health experts are concerned about a spike in opioid use, specifically fentanyl. KSBY News reporter Sydney Brandt spoke with the Atascadero families who share their painful experiences losing a son to the deadly drug. The opioid crisis has been on the decline in San Luis Obispo County for the past few years, but there's growing concern over fentanyl, which can be 30 to 50 times more potent than heroin, and it's taking the lives of people right here on the Central Coast. An empty chair and supporters along the streets Sunday speaking out against a deadly drug crisis.
I just think, what is fentanyl? That'll never happen to me, and trust me, it became real.
Atascadero mother's Cindy Sorrentos.
I found my son lifeless in his room from taking what he thought was ecstasy.
And Cami Velsey.
He was having intermittent wisdom teeth pain and purchased a Percocet to help him with that.
Both lost their sons to fentanyl poisoning this year.
We've become somewhat desensitized because of how often we are prescribed painkillers.
This pain-killing drug is dangerously lethal and more easily available, and it only takes a small amount to kill, even for first-time users. Warren says when it comes to age, the opioid crisis doesn't really care.
We do see a lot of younger demographics in our overdose rate, people between the ages of 19 and 30.
But for those who have seen the effects of this drug, they say overdose is not the problem.
It's drug-induced homicide. These are not overdoses.
Some saying drug dealers are peddling poison for profit.
It does become a cheap way for drug dealers to increase a high for less cost on their end.
Jaime Puerta from Santa Clarita lost his son this April to fentanyl.
He was only 16 years old. He was my only son.
He is pushing for change in legislation like AB 109 and Proposition 47 to bring light to the realities of the opioid crisis.
It's unbelievable the amount of children that are passing away due to this. This is the real pandemic.
Warren tells me that the county's behavioral health department has seen a correlation between the COVID-19 pandemic and an increase in this kind of drug use. And he tells me that the county does have an opioid safety coalition, which works to continue the conversation about the opioid crisis here on the Central Coast. Reporting in San Luis Obispo, Sydney Brandt, KSBY News. Some health experts are promoting the use of naloxone, an overdose reversal drug that has become increasingly available over the counter. Law enforcement and medical professionals typically have naloxone on hand.